For both Dr. Henry and Minister Dix, I'm trying to get an understanding of where we're at with AstraZeneca. I understand there's been a substantial drop-off in the number of people who have received the vaccine since the NACI guidance was put out. Can you give us a sense of how much that drop-off was, and whether the federal government has offered BC additional AstraZeneca, and whether BC has accepted that offer of additional doses of that vaccine?
Yeah, so I can tell you that there's a combination of things, and yes, we did see some drop-off, but it's unclear for us exactly how much, because there's a bit of a lag when in pharmacies entering data into the system, and there was a bit of a glitch on that on the weekend. So we did see it drop off quite considerably, but it's picked up again yesterday and today. So we think it's partly a data thing, and partly people making that decision. Before last week, we were about 50-50, where people were making the decision to have a second dose of AstraZeneca or to opt for a Pfizer or Moderna dose. And part of that was because our second dose clinics, our mass clinics, were still being very well subscribed by people who were in the age-based program. So it was easier for many people to get their AstraZeneca dose. And really, people who committed to getting AstraZeneca, when they did, many people committed to getting 2 doses of the same vaccine, and I think that is a perfectly valid decision to make, and certainly a recommendation that I have made to some of my family members, and it is a very good and safe and effective vaccine, and we know that from the millions of people around the world that have received it. But Minister, did you want to talk about some of the data? Yeah.
On AstraZeneca, because our data over the weekend, the data that was posted yesterday, didn't reflect all of the doses of AstraZeneca that have been received. There has been a drop-off since the NACI recommendations of Thursday. In the days leading into that, we were doing about 6,000 doses of AstraZeneca a day. Over the weekend, so these two numbers add up, 1,204 plus 13,350 over 4 days. So that's roughly 14,000, well, it is 14,454 doses over 4 days. So you see a decline, absolutely, in the AstraZeneca against what we were doing before. Not as steep a decline as our dashboard showed yesterday, and as people rightly reported, and the reporting was absolutely accurate, the dashboard hadn't picked up all of those. So what we've seen is a decline in AstraZeneca from between around 6,000 a day to in the 4,000, just under 4,000 a day range over the last since the NACI announcement, and that it continues to be available, as Dr. Henry says, in pharmacies around BC, and I know many people are choosing the option to have a second dose of AstraZeneca after having received their first dose of AstraZeneca. So a decline, yes. In terms of the amount of AstraZeneca, we are and will be receiving 10,000 additional doses this week, which is a relatively small amount, but will help and helps us continue to sustain that program into the future. Our expectation this week overall in terms of doses, 10,000 AstraZeneca, 896,000 Moderna. How about that? And it hasn't arrived yet, but 327,000 doses of Pfizer. So we're going to have vaccine, and the key is for everyone to get registered and get vaccinated.
Richard, do you have a follow-up?
AstraZeneca
I
is
an answer there on whether the province has turned down any doses of AstraZeneca from the feds, but I'll leave that there. I also need to ask about schools. There's a study out done by
Richard,
UBC.
the answer to the first question is no.
Okay, thank you. Thank you.
I'm just wondering, with regards to AstraZeneca, if there's a bunch left over, is there any way that you would possibly give that as a second dose to people who had mRNA vaccines? And also, I know we've seen in some places that people who got Pfizer aren't happy with getting Moderna. Are we seeing any refusals here in BC?
You know what? I think there's a little bit of brand shopping in that people who get Moderna are on Team Moderna and people who get Pfizer are on Team Pfizer. And same with AstraZeneca. Really what we need to focus on right now is that the mRNA vaccines really are, I think it was described in one of the articles I read as, different water bottled by different companies. They are the same, very much the same antigen, the part that stimulates your immune system. They're wrapped in a different lipid nanoparticle, but other than that, they are interchangeable. And we've seen with millions of people now that it's safe and effective to do that. So I don't see a scenario where we would give AstraZeneca as a second dose, with the one exception of people who have had an allergic reaction to an mRNA vaccine, and then AstraZeneca or a viral vector vaccine, or there are a number of other vaccines in the pipeline, would be a viable option as a second dose.